Hi, I'm Dr. Steve Knighton from Nottinghill Family Wellness Centre. The earlier video we showed you the anatomy of what would be causing you sciatica pain. Today we're going to show you the actual treatment we do. So in most of our cases this will be the same, whether it's the low back causing it, the SI, or the piriformis, but we'll go through a little bit of each one. If the low back's causing, we'd start our IFC machine here. It's an electric stim. They come on with suction cups and it's like a deep massage and loosens you up. We usually put a heat pack on that too, just get a lot of blood flow going, and in turn keep that on you for about 8 to 10 minutes just to loosen stuff up. After that, we're doing a thing called Shockwave. Shockwave is a pneumatic gun. There's a bullet in the tube that comes back and forth here and contacts the head here. It can be a little bit painful in some patients, but other times it's okay. So we find the area of the pain. If it was your SI joint, your piriformis, we'd run it down here. We put a little bit of the ultrasound gel, and then basically there's a bullet. You turn it on, and it hits you through here. We'd work over this area really good, hitting it for about 800 to 1200 times. If it was the SI joint, we run it in here off the glute, and then if it's here, we run the piriformis for about the same thing. Sometimes it's a little further down, and we'll actually work in the top of the hamstring here. After this, we recommend people when they get home to ice it. For sure, we send you a link for that. So after the Shockwave is done on our patients, we usually do some ART or some deep muscle release. If it's coming from the low back, we get in pretty deep in here and dig in pretty deep, get in that QL muscle and right into the nerves. I might move the leg, I might move the back a little bit when I do that. If it's in the SI joint, we usually get the patient on her side, but she'll just stay here, and we work the glutes over, which when we do the adjustment helps that SI joint move easier. Finally, the piriformis, which you get a lot of the sciatica with, we do some ART and some active release in here, where we basically poke my thumb in and then move the muscle around. You can even see in our patient here, she is pretty tight on this right side. Once again, we're sending you home with some icing instructions and some stretches at home, but sciatica is a symptom and not a diagnosis. These are the diagnoses, and sciatica is basically defined as a nerve pain shooting down past the knee into the foot. Okay, so for sciatic treatment, the reason you're here is really that Shockwave machine and the adjustment after. So after the IFC and the heat, after the ART, after the Shockwave, all those things are used to loosen you up, we get into the adjustment. So let's just say in this case, the patient has a left side sciatica issue. So that's shooting pain down past the knee. It's either coming from the low back, the SI joint, or piriformis. We're going to adjust this back. So bad side up. We're going to take the patient in like this. Now, depending on where it is how I adjust. If it's low back, I come in, it's going to be tough to observe, and I kind of hit straight down. If it's more of an SI joint, I scoop the bum a little bit and hit like that. Piriformis would be the same thing. So we usually do this on both sides and then progress from there. Depending on the back and how bad the person is, I'll get the patient to go on her stomach for a second. We do focus on the lower bra line in here. Now I can do this face up or face down on the patient. Today I'm just gonna do it face down so you can see it better. I'm gonna to take a big deep breath in and out, and I'm just gonna adjust the very, very lowest spot of her back in there. So that's the lowest thoracic spine, the highest in the lumbar in there. Like we're going over the anatomy, it can help free up the tissue of that disc and to start relieving that pain going down. So the final, most important step of the sciatic treatment is the low back adjustment and all the stuff we do before just to get it to move.